How do hospitals determine when someone has died? David Greer is a neurologist with the Yale University School of Medicine, and he led a study that looked at how hospitals determine when to declare someone brain dead. And he found out that hospital policies are actually pretty inconsistent from hospital to hospital, and that they've averaged more failures than you might expect merely in figuring out whether someone is dead. Researchers looked at nearly 500 different hospital policies. A majority adopted policies that Greer himself laid out about 6 years ago, but how the policies were adopted varied pretty significantly from one hospital to another. At 20% of hospitals, in one of five hospitals, doctors are not required to check their patient's temperature to indicate whether or not brain function is normal. At half of hospitals, doctors are not required to ensure blood pressure is adequate for brain function. A portion of doctors admitted to skipping the tests altogether that the guidelines set forth to determine if someone is dead. And additionally, some hospitals now allow unqualified personnel to determine brain death, a nurse practitioner or a physician's assistant, rather than actually bringing in a neurologist to determine if a patient has suffered brain death. And in the last few years, in previous years, the medical establishment defined death as a person's loss of personhood and not necessarily by a heart that could not be restarted. And this is a really, really big thing, Lewis. When you consider organ donation, for example, many patients find that they are not as dead as previously thought when on the operating table. We had this story 6 years ago of Colleen Burns, who was on the operating table with doctors about to take her organs. She was an organ donor. When she opened her eyes, she was found unconscious in her apartment, rushed to the hospital, and because she was allegedly unresponsive, the medical staff said, "Oh, this person is dead." But then some nurses noticed that she was curling her toes when tickled. Those reports from nurses were reportedly ignored. This became a huge, huge scandal. And apparently it's not common, but it's not as rare as we might hope.
Yep, like I say, incompetence all over the place. I just covered a story on the Bonus Show where a father who just basically had a feeling, okay, it was pretty common for a parent to have, that his son was not brain dead after having a stroke.
Right.
And there was a standoff. He brought a gun into the hospital and would not let them take his son off life support. The SWAT team brought their own doctor into the hospital, and that doctor very quickly determined, of course the father probably didn't know this, that the son was not brain dead.
Right.
He was responsive and he made a full recovery.
And there's this nightmare scenario of being put into a casket, right, and waking up because you're not really dead. That's not actually too likely. This hospital story, though, about determining exactly when someone is brain dead, you would hope, Lewis, that there is an absolutely universal policy for determining brain death and implementation of the policy. But what we're finding out is different hospitals have adopted different elements of Dr. Greer's policy, and how closely hospitals stick to that policy also varies. Not really what you want to hear when you hear about hospitals figuring out when people are dead.
Perhaps this is just another byproduct of our ridiculous for-profit healthcare system, and just an overall lack of regulation in this country altogether.
Yeah, I don't know if it's, how is it related to the for-profit thing?
Well, because all of these hospitals operate as individual entities.
Oh, I see what you're saying.
And you know what I mean here. There's not,
Yeah, but there's still, the regulations should still extend beyond a hospital determining what it wants to do. But I guess
but those
different
are the
decisions are
hospital's
made.
own regulations.
Right.
I mean, those regulations aren't coming from anywhere else. They're coming from within this, a lot of the time, for-profit entity.
No question about that. Yeah. So scary stuff. Not something that we all want to go completely crazy about, but certainly something to be aware of. It is going on.